Well, welcome back, folks. Do you suffer from major hip pain or joint pain of any kind? Well, our next guest can really help you out because he specializes in arthroscopic surgery. Dr. Christopher Nin, nice to meet you.
Nice to meet you also, Ken.
And I see you're with Pacific Coast Orthopedic Institute, and that they have a couple locations very close by, correct?
Yes, we're out of Fountain Valley and also Irvine, California.
So very, very close by. Tell me a bit about your practice, but in particular, you specialize in fairly new techniques in this medical procedure, correct?
Yes, I am a sports medicine orthopedic fellowship trained. I specialize in joint replacements. And what's really exciting is in the last 5 years, the joint replacement surgery has been very innovative, very minimally invasive, and it's just been awesome technology.
How do you, first of all, diagnose someone who may need a specific kind of treatment rather than, let's say, someone who just has minor aches and pains or a nagging muscle pain or something like that?
So arthritis is one of the most common diseases in the United States. And here we have is a diagram of the hip joint. Mm-hmm. And the hip joint is basically a ball and a cup. And right. When the joint is worn down, when there's no more cartilage, you get bone on bone grinding, then it's time for a hip replacement. And that type of pain lasts all the time. It's dull, aching, intermittent sharp shooting pain. It doesn't stop like a regular injury. It continues on, and it's constant, every day, worse with weight bearing and walking.
Yeah, I've heard about that. In fact, my brother-in-law is going under some surgery just for that reason in a short while from now, and he's talked about that just for months after months. It's a pain that is debilitating. It affects you. You can't sleep right because no matter what position you get in, and to have these new types of minimally invasive treatments, it's a replacement surgery, correct? Where you're not making the huge incision that used to be done in years past.
Right. So before, and also kind of the standard techniques of the past, we used to do a posterior approach. That means we would make an incision behind in the back of the hip. Now this is a diagram of a hip replacement. And what we do is we remove the ball, we place a stem that has a ball in it, and we match the size of the patient. And then we also make a cup for the cup portion that's worn out. So we replace the cup and the ball of the hip with metal and plastic.
What type of metal do you use? Is it titanium?
Titanium, also cobalt chrome. It's a harder metal, so there's more length of lasts longer. Also, it's smooth, and so there's less friction and less wear. Now, the new technology, we have better plastic. It's called cross-link polyethylene, and so that plastic lasts a very long time. We're talking about 15 to 30 years in total joint replacements.
Wow.
Yeah.
And what is, when you're using the two different types of metals that you use, the body accepts those metals?
Yes, they're inert metals, okay, and also we use sometimes ceramic coating, and that even lasts even longer, and they're completely inert to the body.
So for lasting up to 30 years or so, someone who is getting this in maybe their 60s or 70s, they're not going to have to worry about it probably ever again.
No, we used to have cement disease in which we use cement for the total hips, but now we do not use any more cement. We basically press fit it in there. So no cement, there's no debris, and so you don't have the osteolysis or the bone being attacked by the cement and your body attacking it. So we have more longevity in the implant.
When you talk about minimally invasive surgery, tell me about exactly what that means in relation to how it used to be done.
Sure. So before, here's a model. Before, we would do an incision in the back of the hip, and depending on the patient's size, we would do incisions 6 to 12 inches. Okay?
Wow.
So if they're a larger patient, we would do 12 inches. With smaller patients, 6 inches. But with the newer technique, we go in the front and we don't cut any muscle, whereas we went posteriorly. In the back, we cut a lot of muscles to get to the joint, but in the front we basically dissect and just split the muscle, so you're not causing bleeding, you're not causing damage to the muscle, and the portion for a bigger patient and a small patient. In the front, we're all the same size.
That's
if you
amazing.
feel in the front, you, me, or someone bigger or smaller, we're essentially the same size because there's really not much muscle there. We just split through the skin right through the joint.
So it's just enough that you need to do your replacement in there.
And the reason why we're able to do that now is we have special tables in which we can attach the leg and pull traction, and the table manipulates the leg so that we can access the front. And that table is developed, and that's new technology in the last 5 to 10 years, and it's been great. And before we couldn't do that because we didn't have a special traction table that can manipulate the leg and the hip.
Now I understand there's also a similar technique that can be done on knees, which is, I would say, very common, especially athletes. Even in this community, you have people that have played golf all their life, and of course you always hear about knee injuries in golf.
Sure. So with the knee replacement, it's the same idea. You have two joint surfaces that are worn down, kind of like a tire of your car. It's worn down to bone on bone, so it needs replacement. Nowadays, we used to make big incisions and cut, but the same idea now, we make smaller incisions, about 4 to 6 inches. We split the muscle, okay, and we open it up, and then now we remove less bone. And the biggest thing about the total knees is the mechanics of the knee. You hear that you get the get around knee, where the mechanics is much more better in terms of function. It's more round, it moves better, better range of motion, and the plastic, again, is cross-linked polyethylene. So when it's cross-linked, it lasts 30 years, 15 to 30 years, as opposed to 10 to 15 years before.
Now, I understand that with these techniques they're using now, the recovery time is a lot less, as well as the side effect pain that may be associated with the surgery, correct?
Sure. Nowadays, with the advent of new anesthesia techniques, when we do total hips and total knees now, at my institution, we do what's called a spinal block. So we numb the patient from waist down. They're actually awake when they're getting a knee replacement or a hip. They're kind of sleepy, but they're awake, breathing on their own. That's much safer. And also, after the surgery, we do a special kind of cocktail anesthesia pain block. So we inject this cocktail into the joint, and it lasts 24 hours without much pain. And then we have a special drain that reinfuses their blood back. So the drain in the first 6 hours, they basically filter out the blood, gives it back to the patient, and so there's minimal blood loss.
Wow.
Yes.
That's really amazing.
Amazing stuff.
I've never heard of that. So the recovery time is a lot less. How is in terms of weeks or months? What's the difference?
So in terms of recovery, they're in the hospital. They used to be in the hospital for knee and hip 3 to 7 days. Now they're in there 2 to 3 days.
Wow.
Okay. Patients get up and walk right away, the same day or next day after. Okay. And also, they're going home, and it's about a 3-month full rehab process. I would say tell patients, first month you're in a walker, transition to cane, second month in a cane, third month, nothing. Patients are going back, playing tennis in these areas, surfing, racquetball. I mean, they're doing it all.
Wow.
Patients now demand to live a better quality of life.
Yeah, they really do. And it's nice to see that the advancements in these type of surgeries have taken place, and that doctors like you have adopted them. And it just creates a much more, I want to say, comforting experience for the patient. Here, by the way, here's a graphic so we can just quickly look at this about the recovery times. This is for hip replacement, right?
Correct. So as you can see here, the advantage of the direct anterior approach, you have an average hospital stay of 2 to 4 days. The conventional posterior approach is more 3 to 10 days.
Wow.
Okay. Now you have small incision. They're talking about 4 inches, and 4 inches for everybody.
Yeah.
It's 4 inches for a 300-pound, 4 inches for a 100-pound, because that's all you need. There's not much muscle. You split it. And then for conventional surgery, you're talking about 10 to 12 inches, depending on the size. And sometimes when they're so large, we used to tell patients, I can't do your surgery until you lose weight. And now we're able to do these surgeries that are patients that are more obese and bigger. No muscle detachment. Again, splitting. Muscles are cut from the bone with the posterior approach. Recovery, 2 to 8 weeks. I have patients going home wanting to go home the next day, but we keep them in the hospital because we don't know what to do with them. We've never seen patients go home the next day, but they feel fine, pain's control, and less blood loss. They're very happy.
And obviously, number one thing I see here is because the muscles aren't cut away from the bone right away, that's going to reduce your pain.
Oh,
obviously.
yes. And function. When
Yeah.
you're walking without your muscle detached, you're stronger, you can rehab faster, and you don't have that limp anymore.
Well, speaking of people that might have had problems with their joint pain, the doctor is going to be having a seminar coming up. In fact, it's going to be on Wednesday, October 9th, up in South Coast Plaza, the Westin at South Coast Plaza. You can see on the screen there, we all remember Johnny Bench of the Reds.
Sure.
And I understand that he's undergone the similar type things, or wish that they had this back when he was having these problems, correct?
Sure. So Big Red, he had a right total hip replacement back in 2004. It's very debilitating, and he's going to talk about how it changed his life. And I must tell you, out of all the surgery I do, the total hip replacement is probably the most game-changing.
Yeah.
Because patients now, they're able to walk without pain, stand, chase their children, be with their loved ones, be very active. Where you can see, if you have a bad hip, you can't walk, you limp a lot, you start hurting other things, your back, your knee, you gain weight. It's a game changer.
Yeah, and I can imagine somebody who crouched behind the plate for his entire career, you would have to expect all his joints from the waist down were just messed up for years. Obviously, even back then, they didn't have the type of training that they do nowadays. So it's nice to see that someone like that got help, even though it was different back then. He's going to be at the seminar, though, right? Absolutely.
He's going to be at the seminar. He's going to be talking, and also he's going to be following me, going to the hospital and seeing the newer techniques. And I actually had Jim Furyk, the golfer, do the same thing, and he was amazed at our total knee replacement when the patient was sitting there completely numb, without any pain, 6 hours after surgery. It was amazing. And Jim Furyk actually said, "I wish Dr. Nin did my hip."
Well, there you go. Well, you can meet Dr. Nin. Again, this is a free arthritis and joint pain seminar. It's going to take place on Wednesday, October 9th, from 4 until 6 p.m. This will be at the Westin at South Coast Plaza. It's right across from the mall area there. I'm very familiar with that area. And there will be a complimentary dinner and valet parking, so you won't have to worry about that. You do need to make a reservation, though, because they want to know how many people are going to come. Dr. Nin, your phone number is on the screen there, 714-432-9990. And they can call at that number to get more information about this,
Absolutely. Right? Last event we had with Jim Furyk, we had over 400 people. And so it behooves you to get out there and get some good information and not be scared, because with the newer techniques, you're going to get up and moving, and the health risks are very low nowadays.
Very good. It's been a pleasure to meet you.
Yes.
And folks, again, that seminar, Wednesday, October 9th, up there at the Westin at South Coast Plaza from 4 until 6 p.m. You get a free dinner with that and complimentary valet parking. Just make sure to call that number, 714-432-9990. Once again, Doctor, thank you very much.
Thank you, Ken.
Folks, we'll be right back in just a moment.